Good evening, this is The Probe. I am MFA Pau and I welcome you to the show on behalf of the entire team. Tonight we are talking COVID, the facts, the science, as well as the strategy. And that's what we're talking about tonight here on The Probe. And it's amidst the new variants of the virus and the sharp rise in cases in Ghana. Shortly, I'll take you to the Jubilee House for updates number 23 on measures taken against spread of COVID-19 in the country by President Akufo-Addo. We're live on the JoyNews channel, Joy Prime, DSTV 421, Go TV is 144, radio is Joy 99.7 FM and a dozen affiliates across the country. We're also live on Love 99.5 FM in Kumasi and of course myjoyonline.com. Tonight, my guest for the show here on The Probe is Dr. Patrick Abuaje, Director General of the Ghana Health Service. We also have joining us via Zoom Professor Gordon Awanderi, is the Director of the West African Center for Cell Biology of Infectious Pathogens, WACBIP we call them. We will also have Dr. Justice Yankson, the General Secretary of the Ghana Medical Association, joining us tonight. And Dr. Kofi Boni is the lead or senior virologist at Noguchi Memorial Institute of Research. That's the show we have tonight, plus your questions that you've already sent in, a number of them, and we'll make time to go through your questions tonight. So do join us, and let's go now, fellow Ghanaians, to the Jubilee House.
Fellow Ghanaians, good evening. I came into your homes on 17th January to give an account of our COVID-19 situation, a situation which, per available data at the time, was not good. To this end, I appeal to you, my fellow Ghanaians, to help contain the spread of the virus by respecting the protocols government had put in place. The hope was that we would begin to see an improvement in our case count as a result. 2 weeks on from that address, the situation is even worse. As of Friday, 29th January, 64 more people have sadly died over the last 2 weeks, bringing the total number of confirmed deaths to 416. Our hospitalization rates are increasing, with the number of critically ill and severely ill persons now at 172. Our hospitals have become full, and we have had to reactivate our isolation centers. Our average daily rates of infection now stand at 700, compared to 200 2 weeks ago. The total number of active cases has more than doubled, from a little over 1,900 2 weeks ago to 5,358 currently. When I delivered update number 22, 13 out of the 16 regions had recorded active cases. Today, all 16 regions have active cases. Indeed, Greater Accra, Central, Western, Ashanti, Eastern, Upper East, Upper West, Volta, and Northern regions are the hardest hit, accounting for 94% of the total number of active cases. In effect, fellow Ghanaians, we have a lot of work to do in coming to grips with the disease. Given that recent studies show that the UK and other new variants are being transmitted within the population, we should all understand that our current situation could get very dire if efforts are not made, both on the part of government and by you, the citizenry, to help contain the virus. The analysis continues to tell us that the spread of the virus mostly occurs in indoor confined spaces with poor ventilation, where people are talking, singing, or shouting without their masks. The imposition of restrictions on our daily routines helped in reducing the prevalence of the pandemic in the country. And government has been left with no option but to reintroduce some of these restrictions in order to help save the situation. I know these measures in the recent past were unpleasant, but over a period, they resulted in a favorable situation for the country. We have to return to them. So, fellow Ghanaians, until further notice, funerals, weddings, concerts, theatrical performances, and parties are banned. Private burials with no more than 25 people can take place with the enforcement of the social distancing, hygiene, and mask-wearing protocols. Beaches, nightclubs, cinemas, and pubs continue to be shut. Our borders by land and sea remain closed. All workplaces, public and private, must employ a shift system for workers, in addition to the use of virtual platforms for business or work. Conferences and workshops can take place with all the appropriate protocols. However, I encourage the use of virtual platforms for such engagements. Restaurants should provide takeaway services and should, as much as possible, avoid seated services. The National Sports Authority and the Ghana Football Association should ensure compliance with the 25% capacity rule in our stadia, with spectators respecting the social distancing rule and wearing of masks. To the revered leaders of our religious organizations, that is our churches and mosques, I entreat you to enforce to the letter the protocols relating to attendance, i.e. the 2-hour duration, 1 meter social distancing, mask wearing, use of sanitizers, and the presence of Veronica buckets, liquid soaps, and rolls of tissue paper. I note that since the reopening of our schools 2 weeks ago, we've witnessed only few reports of cases among students. I appeal to school authorities and teachers to enforce the guidelines provided by the Ghana Education Service, and I urge the Ghana Health Service to continue their surveillance at the schools so we can contain any reported cases. As we step up public education and enforcement of the protocols and public gatherings, let me also state that regulatory agencies will undertake random checks to ensure conformity with these rules, and the security services will be tasked to enforce them. You do not have to be arrested by the police before you wear your mask. Your workplace should not be closed for non-conformity with the protocols. If there's no urgent reason for you to be outside, please stay at home. Each one of us can help to contain the spread if we continue to practice the measures of social distancing, washing our hands with soap under running water, refraining from shaking hands, and wearing our masks whenever we leave our homes. These measures must be respected by all. I urge you, my fellow Ghanaians, to continue to pay attention to your health, improve your fitness levels, and eat our local foods that boost your immunity. Should you at any time feel unwell or exhibit the most common symptoms of COVID-19, such as fever, dry cough, tiredness, please report to the nearest health facility and get tested. COVID-19 tests are free for all Ghanaians at public health institutions. If a Ghanaian citizen returns a positive result, the cost of care at isolation and treatment centers will be borne by government. At the 58th Summit of the Authority of ECOWAS Heads of State and Government, held virtually, it was agreed that the cost of the COVID test for inbound ECOWAS nationals be pegged at 50 United States dollars at the Kotoka International Airport. The cost of the tests for non-ECOWAS nationals still remains 150 United States dollars. ECOWAS nationals and travelers who test positive will bear the cost of the mandatory isolation and treatment. Ghanaian nationals, however, who test positive upon their arrival into the country will have their isolation and treatment costs borne by the state. Fellow Ghanaians, in update number 21, I indicated that Ghana is set to procure her first consignment of the COVID-19 vaccines within the first half of this year. Since then, a lot of work has been done towards the realization of this. Our aim is to vaccinate the entire population with an initial target of 20 million people. Through bilateral and multilateral means, we're hopeful that by the end of June, a total of 17,600,000 vaccine doses would have been procured for the Ghanaian people. The earliest vaccine will be in the country by March. The Food and Drugs Authority, FDA, will use its established processes for granting emergency use authorization for each vaccine in Ghana. As President of the Republic, I assure you that only vaccines that have been evaluated and declared as safe for use in Ghana will be administered. Government will continue to monitor our COVID-19 situation and will remain resolved in ensuring that we are able to return to normal daily routines. I remain hopeful that if each one of us embraces fully the safety protocols and we continue to put our faith in the Almighty, we will emerge strongly from this pandemic. And Rianom, if Ibra minimo kasaya no, na ochi mienu nie, yare no eyi huba, fa na efa nipa. Misramo, mo bi anfa yare no indi agro. Mundi sise no so. Ni titru, mo se mas no, eno ene beboa yen. Nyame me, oti enyone, mi kenya wie. Hela efe gbeye. Ikemen yawa, ni panyofai, moko ke hela akashwe. Nye yamlano, ni titru mas we. No bab wawo. My faith in God tells me that this too shall pass, for the battle is the Lord's. May God bless us all in our homeland Ghana and make her great and strong. I thank you for your attention and good night.
Just gone by is update number 23 by President Akufo-Addo. Well, we've been waiting for this update to know exactly what it is that's going to happen, knowing that the cases have been rising at what? The infection rate, we're told, is 700. That's what the president says. So for the past 2 weeks, 64 more deaths have been recorded. Now 416, that's where we stand. Our active cases is 5,358. That's where we stand. And we've been talking about the Greater Accra, the Central Region, a number of them accounting for 94% of the infections that we've recorded. Hospitals is no news now. Hospitals are getting full. We've been talking about it. And the UK variant is in the country also. We'll be talking to the scientists this evening. And more importantly, restrictions have been reintroduced. If you missed that, we are returning to restrictions. It's been reintroduced. So until further notice, funerals, weddings, parties, theatricals and others have been banned. And we have private funerals for 25 people. Beaches, nightclubs remain shut. Borders by land and sea remain closed as well. And then workers have to start introducing a shift system. Conferences and workshops, however, can be held, but virtual platforms are encouraged for you to use them. Restaurants can still operate takeaway systems. GFA, National Sports Authority, have been also asked to, introduce 25% capacity in our stadiums. We've seen what happened over the weekend with the Olympics and Accra House of Hope game, and they've been concerned about that. The issues about churches, religious bodies, a number of pastors have been concerned about this particular situation. You are to continue to enforce the protocols and 2 hours of service maximum. And then also 1 meter social distancing has to be in place. Masks is a must. And then Veronica buckets and the use of, washing of hands and sanitizers, also very important. For schools, a number of parents are also concerned about that. For schools, the Ghana Health Service is supposed to continue surveys in all the schools to enforce the safety protocols. And that's where we are now in terms of update number 23. No need to go further because all the questions you have will be addressed tonight by our guests, both in the studio and also via Zoom tonight. And I have Dr. Patrick Abuaje, Director General of the Ghana Health Service, in the studios with me. Also, we have Dr. Justice Yangsin, the General Secretary of the Ghana Medical Association, also my guest tonight in the studio. Welcome, gentlemen.
Thank you.
And then also via Zoom, we have Dr. Kofi Boni. He's a lead virologist at the Noguchi Memorial Institute of Research. We also have Professor Gordon Awendere, Director of the West African Center for Cell Biology of Infectious Pathogens, also joining us via Zoom. Thank you so much, gentlemen, for your time tonight. And I'm sure, Dr. Justice Yangsin, some will say you are a happy man tonight because the GMA had been drumming it in our heads that there's a need for some restrictions to be reintroduced. Satisfied with what you've heard so far?
Well, I would say the updates really put the picture the way things are at the moment. And the sort of things that we needed to do, the president's latest update has actually alluded to a lot of them. As you just rightfully said, we have all been talking about the need to ban the public gatherings. And I think the first step has been taken. So funerals, weddings, what have you. Yes, there are still some exemptions, but of course, it is still subject to the way we all conduct ourselves and the way the disease also treats us. So I think that for all those who were talking about lockdowns and all the bits, like the president said in the past, all these things may be on the table, but it all depends on us. So let's mask up, let's do the physical distancing, let's wash our hands with soap, sanitizers, let's avoid the crowds and what have you that the president has spoken about. And then hopefully we may be able to start at least slowing the current trend that we are experiencing. And then from that point onwards, I'm sure the other chips will also fall in place. But if we don't adhere to these things and we end up with the cases worsening as we are seeing, then clearly I'm sure the president will come back to our homes again. But the onus is also now on the law enforcement agencies.
Okay.
Well,
we'll get into all those issues because the number of questions tonight, we'll try and go through loads and loads of your questions that you've sent in. So Ghana Health Service, you have a task also, Dr. Patrick Abuaje, during the president's speech, asking that you continue the surveys in the schools to enforce the safety protocols and all. There were parents that were concerned whether there was going to be a shutdown of the schools again and all. But since schools reopened, what's the status in terms of reports that you've gathered across the country in terms of compliance and whether we've recorded cases in any of our schools?
Yeah, thank you very much. Since school reopened, we've been intensifying our surveillance. I think the last press review, I updated that we have 3 cases in Upper West and 1 case in the Western region, Abuase. Subsequently, we've had, I would say, close to about 20 isolated cases in Greater Accra region. And all other regions remain silent in terms of cases. And so that's quite good. But this is in view of the fact that we are looking at 9 million pupils and children who have gone to school. And we feel that it is possible that things are working. Teachers are on alert. I think parents are also pushing. So far, our monitoring has seen, with the exception of a few areas of social distancing, which we know that such an easy, because even we are not doing the social distancing. If I bring the tape here, it will not be 1 meter.
It's not?
It's
okay,
not.
so I'm wearing my mask. I'll stay far away as possible from you.
Seems to be okay, and I believe that we can ramp it up. So far, it's been okay for now, and the surveillance is ongoing.
How are the KG students coping?
In all these things, we are talking about a large number of samples that have been taken. So, for example, you have one case in Upper West, and we have to sample another 34 of them, out of which we got 1 positive. And so a lot of surveillance and response is taking place. And there are areas that there are suspicion, and we test them, and there's nothing. So it's not like nothing's happening, but that's so far what we have.
Okay. Well, let's go to Zoom now and quickly bring in Professor Awendere and then also Dr. Kofi Boni. I'll start with you, Professor Awendere. So we've heard about the UK variant as announced by the president, but there are concerns also, people asking whether there's a Ghanaian variant of the vaccine, of the virus, I beg your pardon, as well.
What's the first case?
Good evening. Yeah. For a virus, that has been around for more than 1 year now, you're going to have multiple variants. What becomes interesting is if the variant, is significant in terms of its behavior and then its, prevalence. If it's starting to pick up, in the population, then it becomes of interest to us. So yes, we have different variants in Ghana, but they were not of any significant interest because they all seem to be regular or normal. Now we have the UK variant coming and basically dominating the local transmission in Accra. So that is where the concern should be now, because it's obviously more transmissible. It's more infectious. So that probably explains why our cases have galloped so quickly. So I think this is where our concern should be, how to get this under control, and also to continue monitoring what kind of variants we have in circulation, because this has to be ongoing. We have to do this on a weekly basis, so that if there are other variants emerging that become significant, they will pick them up. Because if a variant becomes troublesome or bothersome, you will start to see higher numbers of it when you sample, and then you also start to see it being associated with certain increased disease severity or death. So that's why we need to keep sequencing the virus and comparing it to the clinical symptoms we're seeing, as looking at the proportion of variants that are in circulation. Just to comment on the president's address, I think that we are all happy that restrictions are back. We've been calling for this for a few weeks. And I think that the situation we're in now, some sacrifices have to be made for us to get the situation under control and have a path to returning to normalcy.
But is that the level you were expecting, or you were expecting more? Because churches remain open, religious activities can still go on, but with limited capacity.
Well, I think it's a good first step. And then we have to monitor and see what happens over the next week or two. What is commonly the case is that the churches do quite well in enforcing people's wearing of masks and washing hands and sanitizers and spacing. The biggest problem has been the social activities where people go and start having drinks and eating food and chatting. And I think that those are the most high risk events, and those have been banned now. So that's a very good first step. If we monitor the cases for a few weeks and we realize that it's not getting better, then we have to tighten some more. And so it will affect even the church going as well. Maybe we can reduce the numbers of people attending church back to 100 or 200 or something like that. With the schools, I think that we have to be doing some random testing. I've been suggesting this for a while. I think if the Ghana Health Service is thinking of bringing on stream antigen testing, which I hear they are trying to do, if we're going to have rapid antigen testing, I think this should be deployed in the schools to do random testing. The Director General is saying that so far we have only isolated cases. It only takes a few days for an outbreak to occur somewhere. If we are not monitoring, if we are always waiting to hear of one case before we go and contact trace and investigate, we'll be caught unawares when there's an outbreak building. So we have to be doing random testing in the schools so that when there are outbreaks, you detect them very early before they get out of hand.
Okay.
So that's what I would suggest to be added.
I'm sure Dr. Aboagye is itching to respond to that, but let me bring in Dr. Kofi Bonny also for his quick opening comments as well on what the president has been saying in terms of the reintroduction of restrictions and what his colleagues have been saying so far. Dr. Kofi Bonny, if you can hear us, I'm sure that you are also excited about the reintroduction of restrictions, no?
Certainly, I am really excited about that. I think the GMA have been calling for this for a very long time now. And looking at what is happening currently, I mean, the way we are having spikes in the cases. If you compare what we had, in July, we had a huge spike, but it's nowhere near the number of new cases we are getting towards the end of January. I mean, what we had, even up to 31st today, is staggering. So I think it is in the right position that we've done that. I mean, one thing that I thought we'll also talk about is the seating arrangement in the public transport. I think it was a very good thing that we started doing. We have now let it go, and I thought it will be brought back. That one was very good, but I don't know, maybe going forward, the president will look at it and bring this back again. The seating arrangement in public transport is of interest and it's of huge concern to me. So that's my introductory comment. So maybe as we go along, I'll come in.
With that said, let's get into the first batch of questions and then we can take another round. Let me also say that we are live on Joy 99.7 FM, affiliates across the country, also on myjoyonline.com. At this point, let's get into your questions. So the very first one on WhatsApp, Kingsley says, how is the GMA collaborating with the appropriate agencies to secure rapid test kits at this critical time? Many countries have approved its usage. Some tech students sent some to the Standards Board last year. We don't know what's going on, and we're also not importing. Meanwhile, many of the countries that have approved test kits have much more superior standards than Ghana. Philip also says we are prescribing azithromycin for every COVID patient. This is one of the most powerful antibiotics in the world. Are we not going to build an immunity to it among our population? What are the potential dangers of a population that no longer responds to the most powerful of antibiotics? It's a night of science. Our next one is from Faustina. It says GHS mentioned COVID testing will now be free in public institutions, but there are reports some of them are still charging patients for tests. When will the freebies take effect? Also, will private institutions cut down the cost of testing? Faustina wants to know. Berima says, what should people do now if they feel they have COVID-19 symptoms? Should they still call the hotlines that were provided back then at the start of the pandemic, or lines no atunsium? How about our COVID app, he asks. And we'll stay on WhatsApp a while longer. The final one for this batch, it says the Ghana Health Service earlier indicated some rapid test kits are being deployed to support the test regime. They should let us know how it is being deployed alongside the PCR test, and are those tests being captured into the national database and being linked to care, and how? So we'll take the number of them, I think 2 of them for the Ghana Health Service, and we'll start off from there. I'm sure you box the 2 together. The very final one that we got, the tests and all. Dr. Aboagye, if you caught that.
Yeah, thank you very much. I think there was the issue of the free testing, what you do when you have symptoms, and then the rapid testing, where they are. Well, generally, the free testing has always been there, just that people were not going through the protocol. So free testing is there. What we are not asking people to do is just get up and walk into a facility and say, test me, because that is going to create backlog, that's going to create testing for people who do not. As long as you meet the case definition, when you feel unwell and you have any reason, either by exposure, you go to the nearest facility. They are all doing triage and they are protecting themselves. They will then give you a referral. Either they take your sample or they make you go and have it tested. Once the samples are taken, it is free. And that is what we do. The only problem is that when people just self-refer themselves, then it becomes a problem for the facility to take action. They may not quickly test you unless you have a very good reason to take you. So that's what you should do, and that's how the free comes in. It's more of getting sure that we also know, and that helps us to understand that we know that this person is awaiting results. We'll tell you based on your symptoms, please quarantine. We are also expecting the results, and so the response to care becomes quicker rather than you now getting your results and trying to see where you can take it to. So that helps us in ripping to areas. Rapid testing, I think it's come up several times.
Yeah.
FDA has taken its time to really scrutinize it. You see, depending on the viral load in any country, a rapid test that works in one country may not work in the other. And so that's why those rapid assessment is, and there are tests that have been hailed in many countries, but they have failed when you bring them here in Ghana, not because the thing is there, but the population they are dealing with, it is not responding appropriately to them. We are revising our policy to ensure that we are putting rapid tests as part of certain circumstances, like rapid assessment. If we suspect an outbreak, or like Professor Wandara is saying, let's do some rapid evaluation of schools. Those things can be done.
I was asking for the antigen testing and all.
Yes, outbreaks, and we have so far registered 2 good antigen tests that could be used. So those are the areas we are looking at.
Okay.
To be able to.
And that will be deployed in the schools?
Well, it's deployed across the country, but it's used in certain circumstances, including where a school has either a rapid assessment has been suggested by Prof, or there's a possibility and we need to quickly do some rapid assessment to see whether people are exposed, and then those who are positive will be confirmed with a PCR so that we know how we are really dealing with.
Okay, so he also talks about the lines that we used to have, and then also the app. What has happened to it?
Well, see, the app is not necessarily an app that, you see, you go for an event, their app is there. You enter to see that I was at this concert, and the information is there. So if people don't use it, you don't see the best. So I go to a concert, I key in that. So when there is an outbreak there, we know the people who were there and where they were living. And that's what that is. So it's both ways. It has to be, the event organizers must use it, and people must also subject themselves to it to be able to be useful. And so if we put it to use, it will work. And so where it has been used, when I've been to the Vodafone concert, I said they were there. They're all keyed in. And so if there was any outbreak, you know exactly who was there, what time you were there, when you left. So those are how it works. And so we're trying to reactivate the lines are there.
Okay.
We'll put in additional people that you can call. But so either you go, you call and get support, or you move into the nearest facility with symptoms. And
so the issues about testing also, which is supposed to be free, but when you test, you don't even get the results. A number of hospitals have been mentioned, for instance.
You see, you elected to go and test. And so the results are entered to the software. You don't know when the private lab or the lab entered your results into the system. And until it goes through the system and reaches the district, they don't know where is it. There are instances where even when the district have called people about their status, they are complaining, how did you get my number? Why are you calling me? So it's not as simple as we are making it look like, but that's why we're encouraging people. That's the way we can all get you quick care, isolate you, and be able to contain the spread of the virus. And so these are all multiple approaches, but we are saying that if we know that you are going to be tested, we are more than ready. Even when your results are not in, we will continue monitoring. There are people who show clear signs of the disease, even though their results are not in. So we start treating them.
Okay. Well,
and that's a benefit of making sure you get your test through an appropriate facility.
So the very first one came for the GMA, how you're collaborating with appropriate agencies to secure rapid test kits, amongst others.
Well, the issue with the rapid test kits is very simple. I mean, in our setup, ultimately it's the FDA that has to approve. And what we have done is to follow the processes, have some interactions with them. One key concern is the issue of false negatives. If you have a rapid test returning a huge number of false negatives, that will create problems for all of us. And the assurance we have gotten through our interactions with them is that they are not taking chances on that level. They want to make sure that at least whatever has been approved by them will not lead us into a situation where the false negatives becomes our Waterloo ultimately.
Okay.
So that bit, we are also in tune with them on that basis, because if you end up with a lot more false negative basically means that the person is positive, ideally should have tested positive, but the result says it's negative. So he thinks or she thinks she's okay, she moves around doing all the things that she's not expected to do, especially if the person is asymptomatic. And by the time you realize, she would have spread the disease all over the place. You remember that famous incident in a factory in Tema?
Yeah.
Only one person,
Fishing.
but it ended up with almost 700 people. Yeah. So that's the negative effect of having test kits that may end up with a lot of false negatives. We will all be in trouble. By and large, the principle is that, yes, let's try and get as much as we can into the system, but in terms of accuracy, we should be as closer to the standards as possible, rather than just for the sake of rapid tests, so we let out anything at all. That would be dangerous for us.
Well, there's an issue also that came up earlier. Dr. Boni, since you test a lot, the issue about inconclusive test results. There are some who test and they are told that it's inconclusive. What does that mean? How come? Dr. Boni, you'd have to unmute.
Sorry about that.
That's
yeah,
okay.
So, yes, you can hear me now.
Yes,
yeah.
we can.
Question about inconclusive test results. We don't tell the client or the patient that we have not, your results is inconclusive. There are so many assays or testing kits that they use when it comes to what we call the PCR testing. So there are some of the assays that you do the first round of testing. It tests for general coronaviruses. Then, if that is positive, then we have to do what is called a confirmatory testing. So the first part that you get the coronavirus, it's a general coronavirus. We have so many coronaviruses, but the confirmatory test will now be specific to COVID-19. So if we do the first test and we get a result that is positive, it doesn't mean that the person is COVID-19 positive. We have to confirm. It could be any of the coronaviruses. So that is where we can call inconclusive.
Okay.
But then when we confirm, then we have now a conclusive or definitive result for the person. So we don't usually tell the client or the patient that your result is inconclusive. That is, your result is not ready. So you will finish with the confirmation, then come back to you and give you the conclusive or the definitive results. So that is what happens. It's not that we are telling them that the result is inconclusive.
Okay, so I shouldn't know if my result is inconclusive. I should just be told that I will get it later. Is that what it is?
You should be told that the result is not ready.
Okay.
The result is not ready. The test plan is ongoing. So you get your results when it is done.
Okay. Well, Professor Rinderi, I don't know if you would take this one. There was one on azithromycin and how we would, develop some form of resistance for it. That was the first question that came in, or the second or so. What exactly is it? Are we supposed to be taking it? What exactly is it with azithromycin and the fear that we may develop some resistance to it?
Yes. Well, I think that's a genuine concern. Any antimicrobials that are being taken at such, mass levels, there's a risk that other pathogens will develop resistance to it. Because when you are taking the drug to treat your COVID, if at the same time you have other pathogens in your body, they would become tolerized to the drug if they survive it. If you don't take it at the doses that will kill it, and they survive it, then they can develop some kind of resistance to it. So it's a genuine concern. So that's why I think we have to be careful with the way people use the drug. There's a lot of self-medication going on now. Anybody who feels like they are not feeling well, they start azithromycin straight away. They don't want to wait. So you don't blame them because people are scared of their symptoms getting severe. But we have to be concerned about what will be left behind, the legacy of bombardment of our systems with all kinds of drugs. Other people use doxycycline and other combinations of drugs to treat. So yes, it is a concern. But we are in a crisis, so we have to deal with the current crisis and then worry about the other ones later. But it is a genuine concern.
You doctors call it the cocktails, and we've walked to the pharmacy now, and you are able to get azithromycin. Is it not supposed to be a prescription drug? Are you supposed to buy it off the counter?
Beyond the fact that we are in a pandemic, I think professionals generally should also stick to a lot of the principles of practice, the ethics and what have you, and the laws governing our practice. This is a prescription-only drug. And the rate at which it is being peddled all over the place, clearly there's a problem. And the regulatory agencies will have to take a second look at it, because antibiotic resistance is a huge problem. And you see, the unfortunate thing is that some of the cocktails that you see on social media and all that, some of them are even outside the nation's guidelines in terms of care for COVID patients. Some of the combinations you are seeing, you won't find them in their standard guidelines that are being used in the treatment centers. People are combining all sorts of things, and it's a problem. It's a problem, and I think the pharmacy profession will also have to start looking from within to see how they can also help to curb the abuse.
Okay.
Yes.
Well, any of you can take this. We've been reading a lot of things when it comes to COVID-19. The latest I'm hearing is that we can also help, cure COVID-19. From we've done the neem tree and all, but where we are today is I don't know if you've heard it, Indian hemp. We're told that it's fast, tatashe.
Well, I have really not heard that one, but I believe that in such a situation where people are desperate to find solutions, people listen to everything, and we need to be very careful that we are not only dealing with the pandemic now, but we also have the after effects of the pandemic. If we finish with a lot of our antibiotics that have become resistant, that creates this whole huge problem. If a lot of people become addicted to these things, because they may not work, and I don't see how it's going to actually anything that is going to affect your lungs. I don't know how it's going to help you fight COVID, and so I think it may just give you some euphoria, and especially when many people recover without treatment because they're asymptomatic. You may think it's working, but it's really, you need to have a proper proof that it's really shows something, because most people will still recover, even if they don't. So don't matter, they don't get to know, or they don't do anything, and they still recover.
Okay.
And so that is why we need to be very careful about all these myths and misconceptions about things that work.
Okay, let's get into the next batch of questions at this point. Quickly, we'll take a number of them, then we can book them together. We're still on WhatsApp. This one says, my question is to Noguchi and Wakbabe. Do they feel stifled by politicians in executing their tasks? Sechibia is asking, the GHS, GES, and the high-level presidential COVID committee met before the president announced the reopening of schools. Have they met again since schools reopened? If yes, what was GHS's input into that meeting? If not, why not? It's been 3 weeks. Afari is asking, how much of the COVID-19 fund has the GHS spent so far? What did they spend it on specifically? Araba says, where are we on a vaccine? Who are we buying from? How much will it cost? Where are we in the queue? When will it get here? Part of it has been answered by the president, but we'll get into it. Sami says some workplaces make staff isolate while awaiting results. Others don't. Should this be a matter of discretion, or should there be one protocol for all? Akiba says, MFA, please, you need to visit some of the universities. You ask yourself whether social distance is in their dictionary. Okay, so issues about COVID fund. Quickly, we need to, give quick answers, responses to the questions so we can get a number of them. What we've been using it for?
Well, I don't know whether this is something you can answer on television, but I believe that a lot of that earlier part has been sent to the parliament. But broadly, we are doing testing, we are doing isolation, we are doing treatment. People who are sick are treated for free, not just for the COVID, but for any other condition that is associated. If you are diabetic, etc., we are buying PPEs, among others. So there's a lot that we are doing. And so I don't think that even at the time of, we have feeding, accommodation of staff, movement of staff here, and there's a lot of training, capacity building for us to respond. Getting a lot of equipment, CPAPs, ventilators, I think it's quite a lot that the money has been used, and that's what has kept us so far as to what the initial successes and the successes that I still think that we are chalking. So I don't, if they want the details, I'm sure there are areas where...
But we don't know exactly how much so far that has been allocated to your outfit, for instance.
Don't walk around with such things in your head.
Well, so I'm sure we'll pull back some of the questions on the screen as we go on so that our guests can get it, the ones that we may have missed. So there's one also where how the Ghana Health Service, GHS, whether 3 weeks now, have you met? What exactly is the situation? Because you met and then advised the president on this.
We've met on several issues. Risk communication, how improving communication. We've met on that. We've met to review the status so far in terms of positivity among students. We've looked at the availability of the logistics, and these are all constant things. It's just even beyond what we do with the national task force itself. Ghana Health Service and GES are virtually in constant touch as we respond and monitor situation across the country. My first day in school, we visited many places together to see how people have come to school, what are the challenges. And so a lot is going on, and I believe that whatever we are doing, we not necessarily an input at the meeting, but we work together to develop all the protocol and standard that we are currently using.
Ghana Medical Association, you're satisfied with what you've seen 3 weeks into school?
Well, we have also sent our people out, and in fact this evening we had our own meeting and we reviewed the situation in the regions. We have an update, and we think that we need to follow what is happening out there. But one key thing that we have also spoken to the Ghana Health Service about is the need, together with the Ghana Education Service of course, is the need for effective strategies that will ensure early detection of any potential cases and subsequently isolating and treating them, because it's such that if you don't have those early strategies to pick them up through whatever means, test them, isolate them, manage them, you wake up one day to see that you have a huge problem on your hands. So we are very particular about the strategies for early detection and then the subsequent events, i.e. testing, isolation, and treatment.
Okay. Well, so there's a question for Noguchi and Wapik joined together. They're asking whether you feel stifled by politicians in executing your task. Dr. Kofi Boni, you take that first.
Well, this question, really, it will be answered by the director of the institute. Whether Noguchi is being stifled by politicians. But what I said, I think there is an easy collaboration between the two. I don't think there is any kind of, there may be some few strains here and there, but I think there is an easy collaboration between the two, actually, when we come to politicians and the work that we do. I think Professor Wandari can answer it very well because he's the director of Public, so he can take the question out.
The ball is in your court, Professor Wanderi.
Okay. Well, I think, like Kofi said, I think this is a partnership. There are times that we have disagreements, but I think we are all trying to achieve the same thing, which is to, help our country fight the pandemic. So there are times where we probably have disagreements about how to get things done. For example, we've been calling for these restrictions for several weeks now. Government has now done that. But there are other areas where we actually work together. So the sequencing, for example, that's a good example of where collaboration is working. When the UK strain emerged, the government got in touch with us, and we put together a plan to intensify the sequencing. So now we have a team from Noguchi, WACBID, and UHAS, University of Health and Allied Sciences, and we are sequencing, samples regularly and providing information. And that's why now you can see that the president, when he speaks, he talks about genome sequencing, because we are doing this in a more systematic way and providing information to guide the response. And that's the way it should be. So we hope that it will continue to collaborate in that manner. Both Noguchi and WACBID, we have different sources of funding. We have grants that are independent of government. So we also have to do our work as scientists. So it's not all the work that we do is not just to provide information to the government. It's also to fulfill our role as scientists, to investigate and to provide information to the world as a whole about what is happening in our country. So we will continue to support the government as much as we can. But at the same time, we would be doing our work, which is that disclosing as much information as we can to the scientific community, because that's our job as scientists based in Ghana. So that's the way it is.
Okay, but Dr. Boni, you test a lot. At least Noguchi, you've stated that you can't speak for the entire institution, but at least you're a lead virologist there. You do a lot of testing. Let's talk about resources, for instance. You may say that you are not being stifled by politicians from where you said, but then in terms of provision of resources for you to do the work amidst this pandemic, is it adequate?
Yes, for that I can say that, well, it is quite manageable. You see, fortunately for us at Noguchi, we have the national coordinator of all the testing labs situated at Noguchi. So going to him is easy for us. So anytime we need any resources for especially the routine clinical specimens that comes from the hospitals, we get to him. Yeah, sometimes we don't get him because he's a very busy person. But you see, just a phone or an email away, you get him and he will answer your call. So for us at Noguchi, we have that opportunity because the gentleman, the man is very close to us. Yes, there are times that it's not shortage, but trying to get him becomes a problem. So it delays in the kind of testing that we do. Apart from that, I think it's been fine because I think the government had a lot of reagent consumables at some point. And, it went down for about 2 or 3 months. So now that it's picking up, we are now getting to use those reagents that were stopped earlier on. So I would say it's not been bad for now. It's not been bad. We've been managing quite well.
Okay, we'll talk about vaccines now because there was a question about vaccines. Araba had a tall list of questions on that. Where are we on the vaccine? Who are we buying from? How much it will cost? And where are we in the queue? When will it get here? It looks like bits and bits for everyone here at this point. But we'll stay on Zoom and the vaccine. The issue about assurances. Exactly what we are bringing in because there are fears about this particular vaccine and the assurances. At least I need some assurances. What do we know in terms of where we are when it comes to the vaccines?
Well, I think, it's very important that we aggressively start managing the information about vaccines because as you mentioned, there's a lot of information out there. Some of it very misleading. and false. And some of these, pieces of information are put out there to scare people from taking vaccines and so on. But I think that, the citizens of Ghana need to be confident that we have scientists in Ghana who are competent enough to determine if a certain vaccine is good for us or not. That's why we're here. That's the whole point of building local scientific capacity. So this whole idea that Bill Gates or somebody is going to bring some poisonous vaccines to come and kill all of us, I think it's ridiculous at this stage. We have gone past that. We are not incompetent here that somebody will give us something that doesn't work and then we give it to our people to take it. So people need to be a little bit more give us some credit that we are not stupid here. Okay, I don't think the Ghana Health Service or the FDA would sit down and let vaccines that are not wholesome be brought into our country and given to our people. So just in general, let's trust the system.
Okay.
That we have people who are competent. Ghana, we've gone far. We have people who know what we are about.
So the assurance is that government is working hand in hand with the scientists in the country to work towards this vaccine. That's the assurance you're giving.
Yeah, well, they've just started the process. But what I'm saying is that before a vaccine is brought in and deployed, the right testing will be done.
Okay.
Testing will be done. So I'm just saying that let's be assured that we are not going to deliver unwholesome vaccines to our people. That's what I'm saying.
Okay.
Having said that, today I heard that the president has now said that we should think about June, which is more realistic.
But March, the first batch he says in March. He mentioned March.
Well, I would discount that. That would just be maybe a few trickles for just a small number of people. For us to get vaccines in substantial quantities, that will make a difference to the people. I think it will be the second half of the year, just based on the fact that there's a queue for these vaccines. People have pre-ordered vaccines. We are now trying to make an order. So, it's not realistic that we're going to be getting millions of doses of vaccines anytime soon. And we have to also realize that most of the vaccines, you need 2 doses. So if you buy 20 million doses of the vaccine, that will vaccinate 10 million people. Okay, so we have to bear that in mind. The president mentioned a target of vaccinating 20 million. That means that we need 40 million doses. So we have to think about these things in a more realistic manner. And I think that we shouldn't raise the hopes of the people that we're going to have any vaccines anytime soon. Because I think that realistically it's going to be the second part of the year, towards the end of the year, before we have any substantial quantities of vaccine in Ghana.
Okay, I'll get to the studio shortly because I see that Dr. Aboagye is itching to speak about this. But Dr. Kofi Bonny, you're at Noguchi also. I'm sure that there's some consultations ongoing. What exactly do we know about this? The president says first batch in March, we should get substantial in June. And the aim is to vaccinate the entire population, and the target is 20 million to start with. What do we know about this?
For Noguchi, Noguchi works hand in hand with the Ghana Health Service. So for now, nothing has been said about all that we know is what the president has put across. But for Noguchi, I think nothing has been done with regards to vaccines that we are going to use to vaccinate the people of this country. So for now, that's what I can say. Nothing has been done. It is when it is about being redeployed that maybe they will come to Noguchi for some testing to be done, like what Professor Wandari just said. So, but for now, nothing has been done or nothing is being said with us for Noguchi about the vaccines. So we wait on what the Ghana Health Service will do. Yeah.
Well, Dr. Patrick Aboagye, so the Arabas question is triggering a lot. She's asking about how much it will cost, where we are, who are we buying from in the first place? Because do we know?
Well, I'm happy what Dr. Bonny ended up with us. Ghana Health Service will know.
Okay.
I think a lot of work has gone on. Before you even bring in the vaccine, you must know the quantity you want. You must work towards it getting registered. You must know how you are going to deploy that. And all that has been done. And that is why the president can tell you that we need 20 million. Not just figure out of the blue. What are the population at risk? What is the number? There are orders already that have been placed long ago. And that's why we can say that much.
Placed from where? Which companies are we working with? We need to know.
Well, I think these are procurement issues.
But we need to know. At least if we are announcing that by March, we have just a month to go, Ghana Health Service will know. We need to know which companies we're buying from.
There are so many vaccines that we are looking at. Okay. And so as they come in, we know the numbers that are likely to come in, probably in February and in early March, so that we can start vaccination. Will come in batches. So there's a lot of work that has gone on to look at that. The FDA is looking at dossiers to register vaccines companies that have brought in them, and that will determine what you got. And in the meantime, as people are pre-ordered, so have we also done our own pre-order, either through the COVAX platform, another bilateral that is going.
But the scientists are discounting that we could get it in March.
Well, they don't know. They don't know what we do. Like Dr. Boni said, they will not know. And so, but maybe we will have to have more interactions to have a discussions on where we are. But these things with the Ministry of Health, and it's a lot of work started long ago. It didn't just start last week. And that is why we have the full deployment plan, etc. And as we wait for registration, as the FDA certifies a safe vaccine, then we complete whatever process. And that's why the president can tell that this is when I expect vaccines to come in.
Okay. Dr. Yangsing, you want to add anything to the issues about vaccines?
Well, I think that, I mean, sometimes in as much as we also advocate for certain things, when we know that certain things are also happening, it is fair we also let the people know. I have been in meetings with authority, the minister designate, the Ghana Health Service, the CEO of FDA, you know, in relation to vaccines, and even other stakeholders that are also interested. I have seen some of the documentations. I have seen, you know, what NITAG has done in terms of the rollout, some of the things that have to happen, some budgeting issues, some discussions with government, Ministry of Finance and all that. That I can say for sure that I have seen, I have been part of them. Not all, but part of some of the meetings, and I've seen what is going on. So clearly there is a strategy in place to procure. But what the people of Ghana need to understand is that whatever vaccine ultimately is approved, or whatever vaccines, because it's not only one vaccine that we have, there are a lot of considerations that also go into choosing a vaccine. If you've read a bit about the vaccines, some you need temperatures of -70, 50, 20 to be able to store them. Would that fit into our EPI arrangement, for instance? If that will not fit, what we do? Do we need to find new mechanisms for storing these vaccines? Because it's not just about bringing it in, but the distribution chain up to the point where the individual will get the vaccine is also important. Because if you don't store the vaccines properly, you're going to have problems ultimately, because they would have been destroyed by the time you decide to go out there. So a lot of things are happening. We already have the EPI, you know, arrangement in place that we use in vaccinations and all that. The costing and all these things, I know some have been done. But ultimately, the most important thing is that...
But from the costings that you've seen, how much is it?
No.
What you've seen?
As for the costings, I can't even give a figure because whatever I have seen is based on some indicative pricing for different vaccines. But mind you, there are other logistical constraints.
How expensive is it?
Well, at least this is not for Ghana. What I know generally is that depending on which platform you are also using to assess, the cost could come down a bit. But generally, you could have some as high as $40, $50 a vial, some 30, I've seen 20, I've seen 10. This is not Ghana. I'm just talking about globally what I have seen.
What you've seen,
So it all depends on what you are going for and the logistical constraints and all that. Yes.
Okay. Our radio audience will leave at this point, and a walk with Jesus will happen. But we continue here. We have some time, 9:30, and then we can wrap up this discussion. But I'll take a few more of your questions, then we take a quick break, then we come back with the responses to them. So let's get into the questions now. Still on WhatsApp, Victor says, should Ghana not have a single strategic plan for combating COVID-19 instead of multiple individual directives? That's Victor. Yoni says, last year there was a plan to convert all the gene expert TB testing machines across the country in every district to COVID testing machines. What happened to that plan? Lai says, is WACPIP conducting another seroprevalence survey as they did last year, which showed that over 1 million people had been exposed to the virus? So that's another batch of questions. I'll take responses to that after this break. Please stay. Welcome back. Thanks for staying with us here on The Probe. It's also live on myjoyonline.com here, also JoyNews on TV, and then also we're on DSTV channel 421. Go TV is 144, and your comments is what we thrive on here on The Probe. So before we went on the break, 3 strong questions. Victor says, should Ghana not have a single strategic plan for combating COVID-19 instead of multiple individual directives? Dr. Abuaje, how come we have multiple directives? Yoni, we'll take Yoni's question.
I don't really know what it means by multiple directives. We have a strategy. You continue to review your situation. As the situation changes or improves, you redefine your strategy. So you cannot just say, I'm going to do this irrespective of what changes. So I don't know what the multiple directives is, but as the situation changes, we move on. As you do your testing, you start with probably some form of testing regime. You revise it based on the situation. You are doing isolation. I mean, so you need to really be responsive to the situation because you are addressing the problem, especially the disease that is new, that we continue to learn something about it every day. You cannot just say, walk through the same straight line, even when there's a change out there.
Professor Arendere and Dr. Bonnie, I'll bring you in also on this briefly, then we can get into the other questions. In terms of our strategy, our topic for today is the fact science and then also our strategy in terms of dealing with COVID-19. So far, you're satisfied with what you see in terms of how we're dealing or tackling COVID-19?
Yes, let me start. For me, I think the government has been commended in many fronts for what he's been doing. I mean, over since we started this COVID fight. There was a time we started doing this enhanced contact tracing and all that. They brought in a lot of samples and all for us to be tested and all that. But it went down. I mean, resources restraint came in and all that. But for now, I'm thinking the strategy that has been or is being currently being deployed, that is, when we have a case, then we quickly go around and do the contact tracing and bring in samples. It's also not a bad idea, but we should be mindful of our resources that we have in place. Currently, they are bringing in so many samples that I think that we don't need to have them. I think we should go towards an area where we will do what we call the symptomatic testing. Because if we are not very careful and we bring in so many of these samples that to me, some people said I'm exposed because I was close to somebody who has tested positive. Does it necessarily have to be tested immediately? I think we should just have to observe the patient for some time, maybe a week. If the patient should start having any of the symptoms, then we try to rule out COVID. But if immediately we go and sample so many people around that person and say we are going to do contact tracing, there will be a time shortly where we will be having serious cases and will not have the requisite reagent or resources to attend to these people. So I think that we should, yes, it's good to do testing, but we should be having a strategy that will help us as a resource-restrained country, so that we don't use what we have now on people that we call contacts, that they could be casual. They are not even close contacts. You just take all of them and bring them in. So I think we should try and redefine, like as Dr. Abuaje said, that as the virus evolves, then we try to redefine our strategies, which is good. But we should look at the issue of resources we have, because if we are pushing in contacts now, which are casual contacts, and we are testing all of them, we'll get to a stage where we'll be resource restrained and we'll be having problems when serious cases come.
Professor Wanderi, our strategy.
Yeah, well, I think we've done some things well and some things we could have done better.
We'll start with the ones we could have done better.
Well, I think decision making, I would say that decision making needs to be much more, let's say, decisive. For example, the restrictions we are putting in place today, we should have done them 2 weeks ago. Okay. So the government, they usually come to the right decision, but we lose time. If we had done this 2 weeks ago, our numbers would have been below 500 by now. You understand? So the decisiveness, we need to. This is a pandemic, so you have to always decide and go for it. If we deter and waste time, you're losing precious days, and that's caused a lot of infections. So we have to be very decisive when it comes to this. Okay. Like when we decide to do mandatory quarantine, we have to go for it once and for all. Then the issue of testing. I think Dr. Bonnie is concerned about the volume of testing. That's because we are relying exclusively on PCR, which is expensive and takes time. I'm glad that the Director General is now saying that 2 antigen tests have been approved. That is going to be very important. We need to bring on board rapid antigen tests, which are reliable enough to at least be able to exclude some people. So you can use it to screen a larger number of people and exclude some people before you go and go on to do PCR tests. Because Dr. Bonnie is right. Okay. The PCR test is very expensive and takes long, but we can deploy rapid tests to help to complement the PCR testing. Because we need more testing, not less. We just have to diversify the testing strategies. But we need more testing because even though some people may not show symptoms, it's also still important to know that they are infected, because the symptoms could be long-term. Okay. Some people have long-term effects of COVID, and it's important that we know.
Well, interesting. So let's do Yoni's question. But most of us are corporates. Once you're exposed to a contact, you want to quickly test, and then now let's look at the new strange symptoms that people are coming up with now. At this point, I'm sure as doctors, are you seeing new strange symptoms that people are coming up with when it comes to COVID?
Well, the first thing is that the new strain, as we've all come to agree and understand, is that it's more transmissible or highly infectious. It spreads quickly. Now, we've also seen that in terms of presentation, when people have the disease, they are presenting with very severe form of the symptoms. And sometimes within a short period, you even lose them. Some will require high dependency units kind of care, so ICUs, ventilators, what have you. So it is such that clearly there's a marked departure from what we used to see in terms of the severity of the disease and the symptoms that they present with. Okay. The other bit is that, yes, we still see a lot more, we still see asymptomatic, mild, moderate, like previously. But the reverse in terms of the population segmentation is that hitherto we're seeing a lot more of the disease in, let's say, the older generation. Now, the youthful population are being impacted more and more. So we are seeing a lot more younger people also presenting with severe forms of the disease compared to previously. But the truth is that no single patient, or we can't have one presentation that cuts across for all the patients that we see.
Okay.
Yes.
Well, we're told some people are now coming up with skin rashes.
Yes, you see, the truth is that COVID, COVID
it's always been
there. COVID, you know, when COVID started initially, the first thinking was that it was a respiratory disease.
Okay.
But in a very short time, the medical community or the scientific community came to understand that, look, it's a multi-organ disease. It affects every single organ in the body. The skin is the largest organ. So every bit of the body is impacted. And depending on which part of your body the COVID situation actually attacks more, you may come up with very bad, problems. So for example, you could have your blood system being targeted quickly. You get blood clots all over the place. You throw showers, you get what we call pulmonary embolism, and that can kill you in seconds. You could have your kidney being attacked. You could have your heart itself being attacked. That's what we call hyperinflammation all over the system. So your brain could be attacked. People go into coma and what have you. So it's a mixed bag. But what we are seeing is that this new strain is highly virulent, and the way the cases present, we are seeing a lot more of the severe to critical.
And how do we explain the number of cases we are seeing in children also? Because with the first...
Yeah, but that's what I'm saying, that, yes, even in the first, we saw cases in children. Yeah. But this time round, we are seeing the disease more in the youthful population compared to previously.
Okay.
So it is not strange that we are seeing a lot more, let's say, people in their teenagers or early 20s and all that getting the disease.
Okay.
Well, I think with the age group, I think I'll be very cautious here. Let's look at the data properly. Sometimes we can see some anecdotal I think they are working. We are yet to see whether there's any further preponderance for the age groups. And so we need to really look at that. You may have some 11-month-old baby come up, that may be a new story. But if you have to look at the data in its entirety to really come up with the fact that this is attacking more children. I don't think so. I don't think we have the evidence to say that more children are being affected.
Okay.
Now we are currently generating data for the child rights group, and I think very soon we'll be able to see exactly what has been the situation as far as the under 18s and the rest are concerned. I just wanted to also respond to...
But DJ, just a quick one. You see, yes, this may be Ghana specific, but within the broader context, from the scientific community worldwide, that's position that, look, comparatively, you are seeing a lot more youthful population. That cannot be disputed now.
Okay.
Yes, but like you say, the segmentation within, let's say, under 6, under 5, or 10 to whatever, that locally we are still working.
Okay.
Yes.
Okay. So I
just wanted to just talk about the testing. You see, about the testing, it is uniquely, you see, under normal outbreaks, we look for symptoms and test. But this is where you have sometimes as much as 80 to 90% of people are asymptomatic. So if you're going to wait for them to fall sick before you test them, they may spread, and that is what we are having to go out the extra mile to test all. Okay. Because somebody may not show symptoms. If we can wait for the next 2 weeks, you won't show any symptoms.
Never show.
And be spreading. And so that is where we have a very unique problem.
But you see, the testing, what we are doing for me is so consistent with what the WHO boss kept saying. The panacea to this includes test.
Yeah.
So as for the testing, for people who are asymptomatic, if you refuse to test them, they will spread the disease. Yes, the cause disparities and
he talks about casual contacts and then maybe
no, you see, it's very
walk-in.
Okay.
It is as a result of the walk-in that I feel someone talked to me last week and I hear he's positive. Let me go and test. And because he has money, he get tested. And that is what is probably...
Okay. Let me get into the final batch. Two questions. Yoni says last year there was a plan to convert all the Gene Expert TV testing machines across the country in every district on COVID testing machines. What happened to that plan? I'll get a brief response to that. Elia says, is WAPI conducting another seroprevalence survey as they did last year, which showed that over 1 million people had been exposed to the virus? Straight to you, Professor Wanderi, on this. Let's get a response to this particular question. The seroprevalence survey, are we still doing it? Last year we were told that over 1 million people were exposed. What's the situation now?
Yes, we've continued to do it. We've actually done some in the Upper East region. Wanted to go outside Accra and also see the level of prevalence. So we've done some in Nabrongo, Bogatanga. We've done some in Kintampo, Cape Coast, Takoradi and others. So it's ongoing. Last week we were in Akropong to do some tests also there. So yes, it's ongoing. And we are still seeing a very high seroprevalence in the big cities. Whereas in the smaller cities, such as Boga and Nabrongo, we found less than 2% seroprevalence. So it's really consistent with where the disease burden is. And I think this issue about testing, that's why I'm asking for us to diversify the testing regime. We can deploy all these methods. We can use seroprevalence surveys to also gauge the level of the burden, especially those who have had it asymptomatically. We can use the seroprevalence surveys to do that. So far, we've been doing this. The Ghana Health Service indicated an interest in doing the same, but I haven't seen them deploying that yet. But I think these are things that we need to do to complement the PCR testing. Testing has to be comprehensive. PCR alone, PCR is the gold standard, is the best. But if you cannot afford to be doing mass testing by PCR, we can use other methods to get a proper gauge of the situation. Okay. Because we keep counting only PCR positives, and as Dr. Abuaji alluded to, the majority of people are asymptomatic and they will not even show up to be tested. So if we say that we have 60,000 people who have been infected in Ghana, we all know that that's completely far below the real number of people who have been infected. That's just the people who happen to have had a PCR test. The real number will be 10 times or more of that.
Okay. Well, but Dr. Boni, since we are talking about testing, there were issues about people's test results being changed. There were allegations at Noguchi, for instance, that they got a positive result, they paid because they wanted to travel, and they got, a negative result so they can travel. We're told that Noguchi was investigating. What is the status of that investigation, do we know?
Yeah, so as far as I'm aware, that issue is still under investigation. I think the director will be the best person to give an answer to that. But I know that it was given to, I think, the BNI to do investigations on that. And it's still being investigated. I know they were looking for evidences from the person who made those allegations. They were not getting all that he said. They didn't get the supporting evidence. So I know that they are still trying to get these things from the person who made that allegation, and maybe they will come out later on with their findings. So it's still under investigations. That's how far I know.
Okay. Well, the final issue about how come markets and trotros are not being regulated as part of the restrictions that have been reintroduced, because if we are not supposed to have funerals, weddings and parties and all, but the markets are still choked. Trotros, I sit in a trotro. So what kind of advice went into that also is a concern, Dr. Abuaji?
Okay. Well, thank you very much. I think that's something I noted down there.
Okay.
See, we are looking at, when we do surveillance, we do case investigations, and so we have, where the hotspots are. We know where positives, there's a likelihood to spread. And during the lockdown, in the immediate few months after that, we did a lot of risk assessment. And that's why we're certain that the markets we're not a place where we're having a lot of positives, and so, I mean, you go to Abobloshe, there would have been a very huge explosion there. We've also not been able to establish any clear link that people are picking the positives from Trotros, and neither are we doing that in churches. But we know that for investigation from parties, from pubs, clubs, dining, parties, and other places, funerals, they are getting.
Okay.
Currently, we do a lot of assessment. We have cases now. We are investigating an outbreak. Says, okay, there's a few cases in Avrongo. Where is it coming from? We don't have any evidence that the church, for now, is a point where
the church is very compliant. We stick to the protocol.
And so we don't have to lock up the place when you don't have any evidence. We don't have evidence that transport is a point of care, because a lot of the time the windows are open, there's a lot of ventilation in those vehicles, and so what we need to ensure is the mask wearing, which is still part of the general protocol that is going. So that is why we are not actually pushing for that, because really you need to have the evidence that there's really something happening there.
Okay, and then the gene expert were told that was going to be
Well, we never said we are going to do all gene expert 1,000 or so. We were looking at 136, and that has been done. They are they are working. Every regional hospital has, and that is why now you are not waiting for somebody who is sick to have a sample sent to Kumasi from Sunyani also, because almost all those big hospitals are able to quickly test. Fiankwanta, some bigger hospital, almost every regional hospital has them. They are working, and they are using. If you go to Western North, and they have them there, and they're able to test their people because they don't have too many cases.
Okay.
And so this issue of rushing around is really significant. So they are all being deployed and they are working.
Okay. I know it won't be enough, but I'm giving 30 seconds each. Then now we can get just closing comments. But I see the list of hospitals and beds available. I don't see BOG hospital. It's missing in that list. How come?
Well, not every. They are not doing managing COVID.
Earlier, we were told that it was reserved for VVIPs.
It was part. Oh, that was.
Okay.
It was part of the facilities that were being considered, but I think we have other diverse places where we are using. Bank of Ghana is not one.
Okay, Professor Wenderi, I'll give you the very final word. You found favor in my eyes. So, really, going forward, what should we know? Your final words and your final thoughts.
Thank you for giving me the opportunity. But I just wanted to disagree with the DJ a little bit. I don't agree that markets are not a place that we worry about. I think we should worry about. We should worry a lot about the markets. When we did our seroprevalence, we found the highest rates in the markets and lorry parks. Okay, so I think that it's there. It's just that there's a high asymptomatic rate, and many of them don't report. They just manage it at home and they don't report it. But it's spreading there. We found in some places up to 30% of traders in certain markets who had antibodies to SARS-CoV-2, which means that they've been exposed. Okay. So it is a problem, and if we're going to make progress, I think we need to also intensify the education over there and ensure that masks are being worn over there. So, to conclude, I think we need to take individual responsibility. The government can do whatever they can do, but at the end of the day, we have to be responsible for ourselves. We have to ensure that we're protecting ourselves and avoiding risky situations as much as possible.
Thank you so much. We will have to leave it here, Professor Gordon Wenderi. I'm grateful for your time. He is the director of the West African Center for Cell Biology of Infectious Pathogens, WACPIP. We'll also have Dr. Patrick Abwaje, Director General of the Ghana Health Service. We had Dr. Justice Yangsin, General Secretary. You have something to give me? The face mask wearing. People are not wearing it. Okay, we'll go. we'll do that. And then also Dr. Kofi Bonny is lead or senior virologist at the Noguchi Memorial Institute of Research. Thank you so much for your time, gentlemen. We can't exhaust it all. We'll do it again sometime here on the JoyNews channel. I am Meme Fapa on behalf of the entire team. Thank you for being a part of tonight's edition of The Probe.